everybody. My name is Dr. Vince Gutierrez. I'm a physical therapist practicing out of Joliet, Illinois. You can find me at movementthinker.org. What I'm doing today is I'm starting a series of short videos. I like them short. I don't like to go on for a long period of time. I talk fast and I talk quick and I like to move on. But it's going to be a series of short videos talking about what to expect as a patient when you walk into a clinic for the first time and they are seeing you for low back pain. And unfortunately, there's a lot of crap out there. I mean, I'm just going to come straight out with it. There's a lot of crap out there, and patients aren't sure if what they're getting is best treatment, good treatment, bad treatment. They just don't know. And I'm seeing these questions on Facebook, and they're being asked to me from people all over the country. And so it's just something that's needed to be done. So let's start off with basics. The first thing that's going to happen is your therapist is going to walk out to the waiting room or walk out to wherever you are sitting and say, "Hi, my name is," I'm going to say my name is Dr. Vince. You can call me Vince. I went to school for a long period of time. I got a doctorate degree. Yes, I have a doctorate degree. You could theoretically call me Dr. Vince, but I've been called Vince my whole life and I prefer it, so just call me Vince. Some therapists may not have a doctorate degree, so they don't have that option, and it doesn't really matter. What matters is whether or not your therapist actually walks out to see you and says, "Hi, my name is," and I almost want to do the Eminem thing, and sounds like they're enthused to actually see you for that first time. You know, I've worked in clinics where I've seen therapists where they're punching in, punching out, doing the 9 to 5 grind, and they walk out to see the patient and they say, "Hi, are you Mr. Smith? Come on down." And like, that's the introduction. Are you serious, dude? Like, if you don't want to be there as the therapist, why the hell should the patient want to be there? So if you're burnt out on your job, then the patient shouldn't want to be there with you. And as a patient, please, as a patient, you have the right to walk away. If your therapist doesn't want to be there and your therapist doesn't come across as somebody who you're going to jive with, walk away. There's nothing saying that you can't walk away. Take your referral and go to somebody else who's actually going to jive with your personality, who's giving you kind of what you need. Okay? And with that, I introduce myself to you. I want you to introduce yourself to me. Tell me what you want to be called, because there are some names out there where I'll be honest, I can't pronounce them. And thankfully, the patient comes to me and says, "Well, just call me this." Sweet. I will do that in a heartbeat. I will just call you that because I can't pronounce your name. And that's fine. But if you want to be called that name, let me know, because that's what I'm going to call you every day unless you correct me. Next, we're going to ask you your age. Some people don't want to admit it. It is what it is. We got your age in front of us, but we're still going to ask you your age. And that there's a few reasons for that. One, we don't want to make the assumption. Two, the older you are, there's a possibility for other comorbidities that we have to keep in mind, such as osteoporosis, high blood pressure, diabetes, just age-related things that we may see that we want to know that whether or not they're possibilities. Third, what do you do for a living, right? Don't tell me you are an electrician. I mean, you can, that's fine. Tell me you're an electrician. But then I'm going to say, all right, I don't know what an electrician does. Tell me what your day consists of. Are you walking? Are you carrying? Are you lifting? If yes, how much? Are you sitting? Are you standing? If yes, what percentage of your day are you sitting? Are you driving? Is the car you're in big? Is it small? How close is your seat? Right? I like to know the details, right? And these are the questions that you should get when you go see a PT. And if you're not getting these questions, then, you know, if you say I'm an electrician, okay, electrician, and we write that down and that's the end of it, that doesn't mean anything to me. I'm a physical therapist. Unless you're a physical therapist, you have no clue what I do during the day. So I'm not going to make the assumption that I know your job, right? And what we need to know is we need to know the movements, postures, positions, stresses that you're placing on your body during your day, and whether or not that has any relevance as to why you're coming into our clinic. I'm not going to keep this any longer than 5-6 minutes, so I'm going to go kind of quick on this last point here. The last thing that we want to know is, outside of work, what types of activities do you do? Yeah, right? It's time to come to grips with, are you active or are you sedentary? And the patients will, and it's funny because it happened today, right? I saw this patient and I said, outside of work, what types of activities do you do? Describe your typical day to me at home. Well, I sit on the couch and I watch TV. And then you see like the lights flicker like, oh, damn, that's all I do all day. and so then I follow that up with a specific question. Would you describe yourself as active or sedentary? Boom. I'm going to make you be honest with yourself for a short period of time so you can see where we're starting, and we're starting at the same spot. If you say active, why would you describe yourself as active? And I asked that, to describe some of the activities that you do during your day. Well, I knit, I crochet, I do crosswords. Okay, are you active or do you keep yourself busy? There's a difference. How much activity do you get during your day? Or are you busy? Again, I want to make sure that we're operating on the same definitions here. And that's cool. If you're busy and that's who you want to be and that's your life, awesome. But if you're sedentary and that's not who you want to be, then you know what? Let's come to grips with it on day one and let's figure out where we're at and where we're going. All right, next. Do you have pain and where are your symptoms? This is the basics, right? This is where we just start some open communication. So I'll typically ask the patient, hey, what's going on? What are your symptoms? Why are you coming in to see me? And we start the conversation. They start telling me their story. And all of this is important because not every patient who has back pain is the same patient, which means not every patient who has back pain is going to get the same exercises as the next person in the clinic with back pain. And if you're in a clinic where everybody's doing the exact same thing, please ask yourself if they all have the exact same complaint. If the answer is yes, well, awesome. Then you're probably in a clinic where everybody should be doing the same thing. If the answer is no and you're all doing the same thing, then you need to question whether or not the treatment that you're getting is individualized for your complaints, your personalities, your problems, and your day. Because in the end, as therapists, we are here to treat you. If you don't have that therapist that has that personality, that mentality, then there's the door. Go find them. There's a therapist on damn near every corner nowadays. I'm sure you can find a therapist that cares more about you than the referral, more about you than the dollar that you're going to produce at the end of the day. Thanks for listening to the first video.